joining us tonight to talk about where we stand with COVID-19, and they'll also be introducing the concept of preventive medicine as it applies to some of the major diseases of our time. He'll discuss with you directly where his research has led him with respect to the prevention of so many of those diseases, especially heart disease, dementia, and Alzheimer's. You won't want to miss what Dr. Nemeth has to say regarding the prevention of these deadly and debilitating diseases. And if you have a question for the doctor, we're inviting you to call 800-859-0957. So stay tuned and we'll be right back after this short break. You're listening to News Talk 760 WJR.
All right, you guys, thanks for tuning in. I'm here with the legend, Dr. Nemeth.
Guys, thanks for tuning in. Hopefully this will be enlightening. I'm pretty sure it will be. Some interesting things we're going to talk about today. So if you have any questions, please call. I'd love to hear them. I love answering questions.
Yes, we are inviting everyone to write in the comments section if they have any questions for Dr. Nemeth. This show is going to be about an hour long, so all right. So this show will be about an hour long. If you guys have any questions for Dr. Nemeth, feel free to write it in the comments section, and during the breaks of the radio show, he will go ahead and answer those for you.
Well, you want me to keep talking to adjust the sound?
Okay, now it's okay.
Is it good?
Yeah.
Okay, so you want to keep it, I'll take
I'm
it
not
down.
going to touch it. I'll just pound on the table.
We're going to try to get to everyone's questions, so if you are curious about anything relating to perio, go ahead and ask.
Can somebody turn off that TV, please?
All right. Someone says, "Hi, Dr. Nemeth, I love your videos. Thank you for posting. God bless you."
You'll have to talk loud because I have these on, and you have to talk really loud if you want me to hear you.
Okay.
With these on.
Someone said that they love your videos. Thank you so much. God bless.
When you
Sure.
ask me something or say something, say it loud.
Okay, will do.
Not that my hearing's impaired.
You have headphones on.
I know.
Welcome to this special edition of the Dr. Nemeth Radio Show, and I'm your host, Anne-Marie Cronin. We're here tonight talking with Dr. Joseph Nemeth, board-certified periodontist in Southfield, Michigan. Dr. Nemeth is with us discussing his state-of-the-art clinic, the latest treatments in periodontic care, and the relationship between gum disease and many systemic diseases, from cardiac disease to the prevention of Alzheimer's. If you have a question for the doctor on the topics we're discussing tonight, please call us at 800-859-0957, and this is your chance to talk to Dr. Nemeth directly. Dr. Nemeth, welcome back. We always have a great show with you, but we're still in the middle of now a new uptick in COVID cases. What are the anxieties that some patients have when they need dental care or when they're calling your office?
Well, you know, it's very interesting because the WDIV, the local NBC affiliate TV station here, was in my office a couple of days ago because they wanted to know what dental offices, mine in particular, are doing to allay patients' fears. And, you know, we did an extensive interview. In fact, it's going to be on tomorrow morning sometime between 6:30 and 6:45. And it'll also be Click on Detroit. It'll be available there. And, you know, we have special high suction devices that we actually put right next to the patient's mouth, so that anything that comes out of the patient's mouth, the aerosols, is immediately suctioned away. We have barriers up between the front desk and the patients so that there's no transmission of anything there. All of the staff is wearing masks, particularly now with the coming back of the virus, of the Delta variant. We also have air suction devices, general air suction devices in every operatory. We have a scanning device, so when a patient comes in and comes close to the front desk, it automatically takes their temperature to make sure everything from being in the dental office. So they may get it outside of the dental office. Staff may get it outside of the dental office. But we're always wearing masks. We're used to wearing masks. We're comfortable with masks, and it's been part of our life prior to this. And so it just doesn't happen. Patients do not get the virus. They don't get infected from being in the dental office. It doesn't happen. So, you know, people may not be as aware of that as they should.
So they need not be apprehensive then. What you're saying is they should be at peace with the fact that you're completely sterile, it's safe, it's a safe environment. Do you think that people are getting the message now that it's safe to go and very important to go and see your dentist or periodontist?
Well, I think they were getting the message, but with the re-eruption of the virus, the Delta variant, I think people are a little bit intimidated again. But again, the dental office is not the place to be afraid of. Maybe other places, yes. The dental office, no. Not just my dental office, but any dental office. Don't neglect going to the dentist because the risk to your health is so much greater than the risk of getting the virus.
Absolutely. What is it that people, listeners, ought to know about what they need to be paying attention to?
Well, you know, a few minutes ago you asked me what are my patients most concerned about when they come to me. And there were 4 things that came to my mind immediately. Well, patients, first of all, they don't want to lose their teeth. They're concerned about losing their teeth. Secondly, they're concerned about the way they look. They want to look as good as they possibly can. And thirdly, many of them are concerned about bad breath. Another major concern is patients who have unfortunately lost teeth. They want to have these teeth replaced, and we use implants to do that. And the primary reason that many of them come, as I said, is fear of losing teeth. And that's a good fear because most people lose their teeth lose it because of periodontal disease or gum disease, which I call the other silent killer because people just aren't aware of how devastating, terribly devastating the effects of gum disease can be, and it's undetected, does not cause pain, people don't know that they have it. It's like high blood pressure, which I've mentioned in the past. It's sneaky, it sneaks up on you, but at least high blood pressure is usually detected by going to the doctor and getting a checkup. That's not necessarily the case with periodontal disease or gum disease, and yet it's terribly devastating and dangerous.
So what should the average patient, the average listener be looking for when they're at home? What would it be the first signals that they need to get in to see you?
Well, you know, as I said, it used to be bleeding. But some of the newer toothpastes have antibacterial agents that kill the superficial bacteria. So patients are coming in, I'm saying, well, you're getting bleeding gums. They say, well, you know, almost never. Well, almost never, or they say not really. When they say not really, that means really.
What does not really mean?
Really, not really means really. But, you know, to them, it's just so infrequent, but often there's little or no bleeding now because of these agents that kill some of the superficial bacteria. But when I go under the gun to take a sample of what's going on there's a lot of activity, a lot of parasites, a lot of bacteria that are associated with gum disease or advanced gum disease, and they're completely unaware of it. Sometimes
I'm gonna jump in here because we've got to take a quick break, but we'll come back and talk about this on the other side of the break. In the meantime, you're listening to the Dr. Nemeth radio show, and we're here talking about the treatment of gum disease and how it can prevent some of the major diseases of our time. If you have a question, you can reach Dr. Nemeth by calling 800-859-0957. Again, that number is 800-859-0957. Don't miss this opportunity to call and talk to the doctor directly. You're listening to the Dr. Nemeth radio show on News Talk 760 WJR.
All right, so Dr. Nemeth, we have a few questions here on YouTube. One is from Juana. She is in Boston, Massachusetts, and she is asking if she can get laser gum contouring done at our office. How could she go about doing that?
it's called calling for an appointment.
Do we get patients that come in from out of town?
We get patients from all over the country, and we've actually had patients from all over the world, Korea, Bahrain, England. Yeah, so we have patients certainly from all over the United States, as well as Michigan, of course, as well as almost everywhere else.
Great. And then we got another one. Someone is also from out of town and wants the pinhole surgery. What could they do to prepare before the pinhole to make sure that they're ready? They want to fly in and get it done with you.
Well, we would have to see them first. We really would. And there's nothing they can really do. They really should continue doing what they normally do. Don't be too aggressive with the toothbrush. Try to be aware of clenching or grinding your teeth. But really, there's not much to do in preparation. It's not a painful procedure, and it's extremely effective. And we've had patients coming in from all over the place, as I mentioned before, to have pinhole surgery to cover recession.
That's great. Last question I have for you. Oh yeah, go ahead. Sure.
Dr. Nemeth, how do people find out about a raid?
I'm sorry?
How do people find out that you're out there? How do they find out about you?
They just do. They Google periodontist or best periodontist, and they find out about me. A number of patients would come from all over the world for bad breath treatment, because apparently they can't find anything that they feel as comfortable with or as assured of getting bad breath treatment as our office. So we're a major center for treating bad breath.
Yeah, that's great.
No, I mean, I think it's incredible that they're, finding you, but I mean, you're probably the only person, you've got a specialty in this, you're world renowned, you're known for treating people with this, and it's great that we have the access in your YouTube channel. You're over like 100,000 subscribers to your YouTube channel, and they're able to go online and see what you're doing, and I think that makes a huge difference. The actual visibility of seeing you in action, treating patients, what you're doing step by step, I think it eliminates the fear.
I've had so many patients who come in and say, I saw your YouTube videos, and I have literally, don't we have hundreds of YouTube videos?
Yeah, we got over 400.
You have a lot.
Videos.
Yeah.
And we have many patients who said, well, I watch your YouTube videos, and I saw you do this procedure and talk about that, and really.
Welcome back to the Dr. Joseph Nemeth Show.
Take
I'm
me
your
confidence.
host, Anne-Marie Cronin. We're here tonight talking with Dr. Nemeth.
Just so you guys know, he is live on the radio right now, and during the breaks, he'll be answering all of your questions, so feel free to add them in the comments below.
The latest treatments in periodontic care and the relationship between gum disease and many systemic diseases, from cardiac disease to the prevention of Alzheimer's. If you have a question for the doctor on the topic we're discussing tonight, please call us at 800-859-0957. So coming back, let's go on and tell us a little bit about what you are, you're obviously getting patients from all over the world, which is great for bad breath, for periodontal disease. What do you think is the biggest part of your practice right now in the middle of COVID?
Well, I think the biggest part of what we're doing right now is laser gum treatment. I mean, that's really what it is. So many people have gum disease. 70%, over 70% of the population over 65 have periodontal disease or
How
gum
do they
disease.
find out they have gum disease? Is that diagnosed to their dentist, or do they find out by bleeding at home?
Many patients are referred by their dentist, of course. So those patients come in, I ask them, why are they here? And they say, well, I don't really know. My dentist sent me here. So what we do with these patients, and with all patients, is we take a swab or we take a sample from under their gum, and we look at that. We put it on a television screen to see what's going on, and we look for parasites. We look for the bacteria that are associated with periodontal disease or gum disease. These patients aren't having any pain, but some of them find that their teeth are getting loose, or the teeth are shifting, or their bite feels funny, or they get some bleeding, or somehow they have an intuition or have a feeling that they've got the problem. Many of them are referred by their dentist and didn't even know they had a problem. But we always take a sample from under their gum, and we use that primarily. That's our primary method of diagnosing periodontal disease. Periodontal disease is an infection. It's a bacterial infection. It's a parasitic infection. It's an infection. If you want to save the teeth, you have to stop the infection. And that's what I tell the patients. We do half the treatment, and you do half the treatment. Our half is stopping the infection. Your half is keeping it stopped by doing what we teach you at home. So it's basically bacterial, parasitic. We take a sample, and if they're there, we know there's disease.
Dr. Nemeth, we have a caller, Michael from Rochester. Michael, what is your question to the doctor?
Well, you know, it's very difficult to answer that question. We have many patients who come to me because they see a new dentist, and the new dentist sees the periodontal disease. The old dentist didn't. But you have to realize that the dentist that you've been seeing has been seeing you for a long period of time, and sometimes it's hard to tell the difference from one visit. It's like watching a child. If you see the child every day or every few days, you don't notice it growing, but if you see the child once every 6 months or once every year, you can see it. So it's not unusual for things to be missed. If you've been seeing the same dentist, sometimes things may not be, you know, noticed or checked as thoroughly as they might be. It just happens. I can't tell the patients to go back to their dentist because I don't know exactly what happened. I was not in the dentist's shoes, I wasn't the patient, so I can't really blame the dentist. Whether it was negligence or not, who knows? So let's move on, let's get you healthy, and it's not gonna really do any good, I don't think, particularly, to get back to the dentist when you don't really know what the condition of the situations were. You were not in his shoes, and I'm certainly not in their shoes.
All right, so Dr. Nemeth, tell us a little bit more about, you mentioned in the last segment about the tooth replacement. My question for you is, if a patient has had a tooth extraction, maybe they had it 6 months ago or a year ago, is it too late to then have a tooth replacement, or have they lost their opportunity?
It's never too late. We put bone in where there's no bone, but almost always we can put an implant in, no matter how long it's been. There are maybe exceptions, but there are very few with the techniques that we have and that we're using in our office. Even if there's not enough bone, most of the time we can add additional bones so that we can almost always replace a tooth that's been missing, even if it's 6 months, and even if it's 6 years, and even if it's 16 years.
I think that's tremendous, because I think a lot of people who maybe perhaps have lost a tooth or had a tooth extraction feel as though, well, too much time has gone by, and you know, the gum is grown over and it's too late, so it's good to know that it's never too late.
I've had patients come into the office and say, well, you know, I wanted to have an implant, but the dentist said I didn't have enough bone. Well, maybe at that time they didn't have to protect, whatever it is, we can now almost always grow bone when necessary, and it's very rare when we can't put an implant in, whether there's enough bone. That would be ideal, but if there's not, we can usually facilitate it. We can usually grow bone where we need it.
Now imagine that people who are having, like, in their front teeth, if they have to have a tooth extraction, their big fear is, oh, I don't want to walk around with missing teeth in the front of my mouth. If they go to you, how soon can they get a tooth replacement? A new tooth, you take a tooth out, how soon?
Well, sometimes the implant can be put in the same day, but usually the tooth that goes on the implant has to wait, typically 3 months, maybe 4 or 5 months, for the bone to grow or attach to the implant. In the meantime, we make it temporary for them to wear so that they look, you know, beautiful, handsome. They're not going without teeth in their mouth, but those are temporary, and then the permanent tooth is made after the implant is attached to the bone.
I think the most important thing is cosmetically, other people looking at these patients, they're just going to see a normal looking mouth. They're not gonna detect that, oh, this is a temporary tooth in the middle, right?
If the patient has a normal looking mouth to begin with, they're gonna have a normal looking mouth afterward. Absolutely. That's very important. You know, every patient is concerned about that. They all wanna have a nice smile.
Yeah, absolutely, especially if it's front teeth. I can imagine cosmetically, nobody wants to walk around for any amount of time that a missing tooth there and have to deal with
It doesn't
that.
happen. It does not happen at all. By the way, I just want to talk about an interesting incident that happened to me just last week. So I was in a health food store, and the owner of the health food store had been to my office about a year ago. I hadn't seen me, but had been examined, and he said to me, well, you know, they did some gum measurements. Well, they were measuring gum pockets, because if there are deep pockets, that usually means there's a problem. He said, you know, there were some pockets like 5, 4, 5, 6. He said, but nothing was bothering me, so I just haven't done anything. And so I told him, I said, you're infected. You have an infection, you just don't know it. Gum disease doesn't cause pain. You are infected, it's affecting your health. You've got to stop that infection if you want to get your mouth healthy. And if your mouth's not healthy, you're not going to be healthy, because it's related to so many other diseases and increases the risk of 25, 35 other diseases. It's really, really puts you at risk.
I think one of the most important, things that you do in your research and in your clinic is certainly the identification of the bacteria that exists in the oral cavity, which we know is responsible for heart disease, Alzheimer's, diabetes, pancreatic cancer, stroke, colon cancer, you name it. You give me a great big list here. It would take the whole show to go down and go through the list. But we want to come back and talk, as we're getting ready to go to break right now, we want to come back and talk about your research. In the meantime, you're listening to the Dr. Joseph Nemeth radio show, and we're talking about how the treatment of gum disease can prevent some of the major diseases of our time. If you have a question, you can reach Dr. Nemeth by calling 800-859-0957. Again, that number is 800-859-0957. Don't miss this opportunity to call the doctor and talk to him directly. You're listening to the Dr. Nemeth radio show on News Talk 760 WJR.
Okay, Dr. Nemeth.
By the way, we can use these questions from callers here as part of the questions that you have. Why not? Why not address that?
Absolutely.
Yeah.
Let me know what the question is.
Absolutely.
When we go back to the air.
Let's let you know as well as me. So let's have a question.
So, someone was asking about a numb or a dead feeling in their tooth. What could it be, and what can be done? Is this a periodontal problem?
Probably not. It's probably a root canal or a nerve problem, because it's the nerve that has the sensation in the tooth. And if it feels dead, it's very possible that the nerve has undergone necrosis or has died, and that's why there's no feeling. Very often there's an infection that follows that, which causes pain, but not always. So not likely a gum problem, more likely a nerve problem.
Mm-hmm. And then someone else was asking about LANAP. Is this something that only periodontists do, or?
No, not only periodontists do it. General dentists are trained to do it, and some of them, I've been doing it a long time, and I'm not going to talk about whether a periodontist might be more qualified to do it than a general dentist, because some general dentists, spend a lot of time and work very hard at learning things, but it's really it's a core part of our practice, and we've been doing it longer than almost anyone in the area, and experience makes a difference.
Great. One last one that just came in. Someone has 2 cracked teeth. They're cracked on the inside.
Anne-Marie?
Yes.
I can't hear this because I can hear you. Okay,
So-
can you repeat that?
Sure. Someone said that they have 2 cracked teeth. They're cracked on the inside. Should they get them repulled and replaced with dental implants?
I can't say. You'd have to really look at the teeth. They may be chipped, but if they're chipped and not cracked, that can probably be repaired. If they're cracked, it's unlikely that they're cracked, because if they were cracked, it would probably be quite painful. So a chip is one thing, a crack is another, and cracks usually manifest themselves by pain, or the tooth really breaks off badly.
Great. Thank you.
That's good that you're getting a lot of calls right now.
Yeah, we get people that are asking questions live, and they pop up on the screen here, and then we got a couple more that just came in if we maybe want to talk about them on the show.
Now, once we go back on air, then you can certainly, regurgitate some of these questions.
Sure.
Yeah, some of the questions I answered earlier, we can answer again.
Exactly, readdress.
Absolutely.
Great.
And next time, we're gonna have a ton of callers.
Yeah, absolutely.
Anyway, we can talk about bad breath.
Yeah, we
Mhm.
want to do that,
Sure.
absolutely.
How much time do we have?
We've got like 2 more minutes.
2 more minutes. Okay, Dr. Nemeth, I have one more question for you. Someone's asking if we have an in-house payment plan for someone who's been watching us for a long time, wants to see you in person.
We have all kinds of payment plans. Without payment plans, it would be difficult for some patients to manage some of the procedures that we do, depending on how extensive. So we have a number of payment plans because we want everybody to be able to have what they need to have. Because if they don't, it really could endanger their health and their life.
Absolutely. Thank you.
So when we go back on, we're going back on in what, 2 minutes? We have a caller, so we'll probably go straight to the first caller that's online waiting to ask your
That's
question.
fine, because we were gonna be online 2 minutes ago, and then it was 2 minutes, and still 2 minutes. It's a long 2 minutes.
It's actually a minute at this point in time, but we should come back and talk about bad breath treatment because a lot of people are concerned about that as well. So Skylar, you're getting a lot of calls over there.
Yeah, well, I wouldn't say calls, they're more comments.
Well, comments.
Yeah, same thing. Questions, exactly.
Certainly questions.
Mhm.
Interesting.
Your hams.
We're the studio audience, so.
Yeah, the studio audience.
If you're talking to me, I cannot hear you because I have these on my ear and I don't want to hear you.
Welcome back to this special edition of the Dr. Nemeth Radio Show. I'm your host, Anne-Marie Cronin. We're here tonight talking with Dr. Nemeth, board-certified periodontist in Southfield, Michigan. Dr. Nemeth is with us discussing his state-of-the-art clinic and the latest treatments in periodontic care. He's also talking about the relationship between gum disease and many systemic diseases, from cardiac disease to the prevention of Alzheimer's. If you have a question for the doctor on the topics we're discussing tonight, please call us at 800-859-0957. Dr. Nemeth, we have a caller, Lee from Grosse Pointe. Lee, what is your question?
Lasers are an incredibly important part of our practice. When we treat gum disease, one of our main part of our armamentarium, weapons against gum disease, is a laser. So we use a laser so frequently. We probably have had more lasers than anyone else in the state or in the country. We currently have 5 different kinds of lasers that we use for different purposes. So yes, gum disease and lasers are like hand in glove as far as I'm concerned. Well, you can use it in your mouth if you really want to waste some time. Because that's not that's a cold laser, and that is not going to get to the bacteria that are under your gum. The laser has to get to the bacteria under your gum, the parasites under your gum, the spirochetes, the amoebas under your gum, and nothing on the outside is really going to be effectively eliminating them. It is true. we know that spirochetes are in the gums. I don't think there's been any studies or evidence directly linking the organisms from Lyme disease to periodontal disease. So I can't answer that. But my own feeling is if you have periodontal disease and then you have Lyme disease, the Lyme disease will be more severe than it would otherwise. That's just my opinion, but I don't think there are any studies on that. Another study did just come out recently talking about gum disease related to kidney disease, and I'll talk about that, you know, if I have a chance in a moment. Well, in men who have periodontal disease, there is a 59%, that can be a 59% increased risk of pancreatic cancer. So, and I'm assuming in women, this study was primarily with men, but I'm sure that in women it's also increased. So yes, there's a definite link between periodontal disease and pancreatic cancer. Strong link.
Dr. Nemeth, let's come back to some of your research and what you're doing in your clinic right now. And I've always been impressed by the fact that you're probably the only dentist, periodontist, person, doctor that's researching the bacteria that exists in the oral cavity and letting patients actually see. They come in, you take a swab, and then there's this great big screen in front of them, and they get to see this bacteria, spirochetes, everything floating around in their mouth. But these bacteria are totally responsible and are the starting point for so many diseases. And I think everybody ought to come in and get this test.
The bacteria that the patients see and the parasites, because there's amoeba, which are parasites, spirochetes I consider parasites. There are many bacteria that we don't see. And when we see these other organisms, amoebas, parasites, trichomonads, spinning rods, sliding rods, we know that these other bacteria, which we can't see, are present. So it's not just the ones that we see that are causing the disease, but we know when we see those that the others are there. And if we eliminate the ones we see, we also eliminate the ones that we don't see.
So when people come into your office and you take a swab out of the oral cavity and then you put it up on the screen and you let them see all this live bacteria jumping around, what can you do to eliminate it? Because I'm sure if I was looking at a screen, seeing everything living in my mouth, I'd say, how do we get rid of it?
As I just mentioned before, one of the things, one of our main tools is the laser. We use a laser. That laser goes underneath the gum tissue. It tends to destroy these organisms. We then clean out those areas very, very thoroughly, and incredibly important, patients have to know how to take care of their mouth once we've stopped the infection. So that's really how we do it. I mean, very frequently we use the laser to stop the infection. It's absolutely critical. But the reason that we show the patients, when we put that up on the screen, I can see it under the microscope, but the patients aren't having any pain. They think
Right.
they're okay. Would you two stop talking over there? It's distracting to me.
Oh my.
Sorry.
Yeah.
You don't know what's living in they don't know what's living in their mouth, right?
They don't know what's living in their mouth. They're not having any symptoms. But when they look at the screen and they see these amoeba and they see these spirochetes crawling around, it's like they begin to realize that there's something not good happening.
And let me ask you another question. Okay, you have the capability of killing the bacteria, of putting a stop to this live infection through your laser treatments. Is this in any way connected to, can they then get rid of bad breath if they're suffering from bad breath? Is there a connection between?
Sometimes. I mean, there's so many things that may cause bad breath. And we have a very large bad breath, let's call it population who come to us. We have a lot of bad breath patients, probably more than almost any other practice around as far as I know. At any rate, there are many causes. One is poor home care. If you're not cleaning your teeth properly, tartar and plaque can accumulate, and that can cause bad breath. But really, the most common cause, and in the vast majority of cases, are bacteria that collect in the way back part of the tongue. And if we can get rid of those bacteria and teach the patients how to keep them off, we can shut off that bad breath just like turning off a water faucet. It's quite amazing. And it's bad breath patients are very interesting because I would say 30%, anywhere from 25 to 35%, maybe even more of the patients who come to me for bad breath treatment don't have bad breath, but they're convinced they have it. But we test them in many ways, and we tell them, there's no evidence that you have bad breath, but they say, well, people are moving away from me and they don't want to be around me, and I'm afraid to talk to people for some reason, they're convinced they have it. And some of them proceed with treatment despite the fact that we don't find it. But a lot of, in those cases, it's primarily psychological, and it's extremely difficult when the patient has it in their head that they have bad breath to dissuade them of that idea because they're convinced of it and they're heavily invested in that. So we have a lot of patients who come to us without bad breath, but convinced that they do, and it's very hard to convince them that they don't.
Well, they take the treatment and that gives them reassurance, but of the people that really do have bad breath, your treatment is absolutely going to clear up the problem.
I would say we almost never have had a failure, but there are other possible causes. So if you have strong foods, if you have onions, or if you have garlic, you are going to have bad breath, and there's nothing you can do about that. But that bad breath was not chronic bad breath. That bad breath will go away in a day or two, and you stop having whatever's causing it, onions, garlic, etc. If you're on a strict diet, if you're on a ketogenic diet, like a keto diet, and you're losing weight, you're going to have keto breath or ketone bodies that are expelled through your lungs. You're going to have bad breath, so that happens too. There's no way to treat that.
Well, I'm going to have to jump in here because obviously we're going to take a quick break. In the meantime, you're listening to the Dr. Joseph Nemeth radio show. We're talking about how the treatment of gum disease can prevent some of the major diseases of our time. If you have a question, you can reach Dr. Nemeth by calling us directly at 800-859-0957. Again, that number is 800-859-0957. Don't miss this opportunity to call the doctor directly. You're listening to the Dr. Nemeth radio show on News Talk 760 WJR.
All right, what's coming next. We've got a number of questions here from our viewers. Someone is asking about laser versus traditional surgery. Which is better?
I'm not going to say which is best. I prefer to do laser treatment. I just find it's less destructive. You're not removing tissue. You're not increasing root sensitivity as much. You're not creating as much space between the teeth. In my opinion, it's much more conservative and at least equally, if not more effective. So I think if surgery can be avoided, it should be avoided. That's my opinion, but I'm not saying one is better than the other. There's one that I prefer. I like it. I'm very comfortable with it, and the results, in my opinion, are astoundingly great.
All right. Another question. Someone's asking, Dr. Nemeth, how do you feel about occasional pipe or cigar use? I'll enjoy one maybe once or twice a month. I know smoking is bad, but it's not daily. What do you think?
I think it's not a problem.
Okay.
Truly, I don't. I'm not talking about inhaling. Inhaling's another story. Cigar smokers don't inhale.
That's what he was saying. He doesn't inhale.
Pipe smokers don't inhale. It's the inhaling that's truly puts patients at greater risk. And a cigar once in a while or a pipe once in a while, in my opinion, is not significantly dangerous.
All right.
Once in a while.
Do you think that warm salt water could be a good combatant towards gum disease?
I think it can't hurt. And it may, if it's in the early stages, a strong salt solution can help kill some of those bacteria.
Great. And let's see. Every time they brush their teeth, one of their teeth, specifically one of them, starts bleeding. Is there anything that they can do?
It's difficult to know. It truly is what's causing it. I think one should go to one's dentist or periodontist and get that specifically checked out, because if one area is bleeding, there may be something more significant going on in that area. There may be a very deep pocket in that area, maybe a source of infection that needs to be detected. Best to get it checked.
Great. Would you be willing to do an online consultation with someone in Romania that has periodontitis?
Oh my goodness, in Romania?
Yes.
Oh,
Andre.
my favorite place.
Yeah.
Sure, I'd be willing to do a very brief one, but not, you know, I probably wouldn't spend a lot of time, but I could probably answer a couple of questions.
Great. Awesome. All right.
Skylar, you know, like, what you're putting me out of business here, because questions that I have.
What do you have?
And just to let you know, we're gonna be back on the air in, less than 1 minute, and when we go to 1 minute left, then that's when we go to our 1 minute close, so everybody keep your eye on the clock, because the close is like 1 minute long, so whenever the timer goes down, you're gonna be, time to sign off.
All right.
So you're getting an abundance of questions here.
Yeah, we got some people asking, 5, 6, 7 questions at once, but I'm trying to be fair and make sure everyone gets their question answered.
We'll throw those questions out.
Yeah.
When
Let's see.
we're back on the air.
Okay.
So we're gonna wait a couple of minutes on some of those questions, till we're back on the air, so that everybody can hear those questions answered.
Are you familiar with something called MISWAK? MISWAK?
What?
MISWAK. MISWAK? A couple people have mentioned that. We'll have to do some
Well,
research
we'll
and
have
make
to
a
look
video
it up.
on
I'm
it.
not familiar with it.
Yeah, we'll have to do some research on that one.
Welcome back to this special edition of the Dr. Nemeth Radio Show. I'm your host, Anne-Marie Cronin, and we are here tonight talking with Dr. Joseph Nemeth, board-certified periodontist in Southfield, Michigan. Dr. Nemeth is with us discussing his state-of-the-art clinic, the latest treatments in periodontic care, and the relationship between gum disease and many systemic diseases, from cardiac to the prevention of Alzheimer's. This is our final segment, so if you have a question for the doctor on the topics we're discussing tonight, please call us at 800-859-0957. We're back on the air, and Skylar is over here at a view, but Skylar's getting more calls or more questions from being online. What are the kind of questions you're getting asked of the doctor?
Someone's asking about natural tooth whitening remedies, and if there's any that you know outside of going to the doctor that may be beneficial.
Natural tooth whitening.
Mm-hmm.
Well, there are many products on the market, and I think probably all of them have some validity or they wouldn't be on the market. How effective they are, it's difficult to say, and a lot of people may be using whitening products, but if you have fillings or crowns on some of your teeth and not on others, your natural teeth are going to get lightened, and fillings or crowns will not get lightened, and you may have a kind of a spotty looking splat.
Are there any periodontal issues behind teeth whitening that you know of?
With strong bleaching agents, you can actually irritate the gum tissue, maybe even burn the gum tissue a little bit, and if the gum tissue is thin, you can cause recession. I've seen a couple of cases of gum recession related to strong bleaching for whitening.
Skylar, any more questions that are, you'll need to let me know so I can repeat them on the air, because you don't have a microphone.
Can the bone in your jaw be regenerated?
Can bone in your jaw be regenerated? Good question.
Absolutely could be regenerated, as I mentioned before, because we have many
Oh, go ahead, Dr. Nemeth.
We have many patients who come in with inadequate bone for implants, and so we regenerate the bone, and some patients come in with periodontal disease and bone loss, and in some of those cases, we may see bone regrowth or regeneration after being treated with a laser or other forms of treatment for periodontal disease.
Okay, Dr. Nemeth, we have a caller online, Mary from Commerce. Mary, what is your question to the doctor?
All right, you guys, he's being asked his final question on the phone. If you guys have any more questions, feel free to write them in. Our session is coming to an end.
Right now, so maybe we should move on.
Oh,
I can't hear her. I'm not
Can
hearing
you-
her.
Can we hear you, Mary? I mean, we're having a problem with, can you hear her now?
I cannot.
Okay, what is your question, Mary?
Very rarely, very rarely. I've had many patients who have had the traditional grafting done where you cut gum out of the palate, the roof of the mouth typically. You cut gum out of the palate and you put that where the gum recession is. And I've had many patients coming to me with having had that done, and those don't always succeed. Many of them, you know, can fail also. And then they come to me and I do the pinhole technique. And the pinhole technique is just so much less traumatic than gum grafting, where you cut gum out of the patient, out of the palate, the roof of the mouth. That can be very painful, very sore, and very often is much more painful than the area where you put the graft. So we don't have to do that when we do the pinhole technique. It's extremely effective, and you're not limited to doing 2 or 3 or 4 teeth by the limited number of amount of tissue that you can take out of the palate. You can do 1 tooth with pinhole, 10 teeth, 30. There's no limit, because you don't have to depend on tissue that you're harvesting from another part of the mouth.
Another question I have for you is, I think that a lot of people are very intimidated by the idea that if they're going to see a dentist, if they're going to see a periodontist, pain is going to be involved. And you basically eliminated the pain problem.
I wish I had.
Well,
We've minimized it enormously.
Exactly.
The laser treatment tends to be pretty much pain-free, very little discomfort usually. The pinhole procedure compared to regular gum grafting, again, much less painful. And we use IV sedation so that the patients are relaxed, they're comfortable, there's no anxiety. It makes it so much easier for the patient and therefore easier for me. So is there pain? We've minimized it as much as we think it's minimizable, and most of the time there's little or no pain associated with what we do. Can't say that's always true, but for the most part I believe it is.
Well, that's what I hear from patients that I know that go to your practice. They say that it's amazing how they're completely, you know, at ease, and that the sedation that you offer and that the medications that you offer when they're there are totally taking the pain out of the equation. And I think that's a big preventative thing that stops people from going to follow up with specialists like yourself.
Yeah, we've done everything we can, and the procedure, we never prescribe opiates anymore. We don't need opioids. We don't need anything that strong. Usually Tylenol or Motrin, if there's pain, usually handles the discomfort. I don't even like to use the term pain, because I call it discomfort, because to me pain is something that needs something really strong, like an opiate or something like that. And we just, you know, we're not using that. I don't prescribe it any longer, and it's not necessary.
What do you have to say, because we've only got a couple minutes left, to patients out there? What do they need to be looking for? You've talked in the past, we've had shows with you in the past where you greatly stressed, you know, taking your oral health very, very seriously. And what do patients really need to know? What do they need to look out for?
I think very often the patients can't tell. And so sometimes they can. There may be some bleeding, or the teeth may feel a little bit loose, or they may be shifting a little bit. Those kinds of things they may be aware of, but very often they're just not aware of anything. And I think it's really important to see your dentist at least twice a year and specifically ask them if there's any sign of gum disease, if there's any bone loss. I mean, address that directly. And I think between, you know, looking for any kind of change in your own mouth, which isn't always there, and checking with your dentist, it'll almost always be detected.
And, you know, being that we have such a dramatic situation with serious diseases in this country, heart disease takes 600,000 people a year, deaths from heart disease, it's very important, I think, and one of the most important things that you do in your office is that you're doing the research and you're looking for the bacteria that is in the oral cavity that gets in underneath the gums and that is responsible for all these major diseases. And I mean, that's a biggie outside of the cosmetic aspect.
You know, as I mentioned before, if your mouth's not healthy, it can take 6 to 7 years off of your normal life expectancy because of these bacteria that get throughout your whole body. They don't just stay in your mouth. They're connected to your bloodstream. They get in your blood. They get into every part of your body, cause inflammatory reaction throughout your body, and make almost every organ worse, and almost every disease, I think, increases the risk of almost every disease and being more severe.
So for disease prevention alone, for the major diseases of our time, I'm telling every listener to call your office directly and go in and let you take a look at the oral cavity and what's going on so that we can prevent prevent some of these diseases?
Well, they don't have to call my office, I mean, that's great, but they should definitely check with their dentist and ask specifically about, you know, if there's anything going on. Of course, we're happy to see patients, but, you know, get your mouth checked, whether it be in my office or, you know, somebody else that you trust.
All right, well, unfortunately, we're out of time, and that wraps it up for the Dr. Joseph Nemeth radio show on News Talk 760 WJR, sponsored by the North American Society of Periodontists. I'm your host, Anne-Marie Cronin, and again, I want to thank Dr. Nemeth for talking to us this evening about taking charge of our health, being proactive, and avoiding the devastating diseases of our time. To take a closer look at his practice, please go to YouTube and search Dr. Nemeth to see his videos on his state-of-the-art treatment modalities. To learn more about Dr. Nemeth's periodontal practice, you can reach him directly at 248-357-3100. Again, that's 248-357-3100, or by visiting him on the web at drnemeth.com. And thank you for listening.
Great.
Thank you.
Thanks. And Dr. Nemeth, I have a couple more questions and then we're going to end.
Sorry, what?
I have a couple more questions and then we're going to end the live stream.
Now, go ahead.
All right. So everyone whose questions have not been answered up until this point, someone is asking what would need to be done to adjust their bite. Could they come into a periodontist?
It can be done at a periodontist office. It can be done at the general dentist office. The bite just has to be checked, and we use special marking paper and other tools to determine if the bite is off. And then we may file a little bit of a tooth here or there to make it even and adjust it, because it's quite important that the bite be even.
Yes.
And not put pressure on one tooth more than another.
Absolutely. Someone else was asking if using braces or orthodontics can help strengthen or regenerate the bone in the jaw.
I'm not aware of that at all, so I can't say it does. And many of our patients who have gum recession, you know, have it following orthodontic treatment. I'm not saying it's a cause, but it could be a link.
Yes. Someone says that they drink apple cider vinegar every day. Would that be damaging to their teeth?
Yeah, certainly the acid can dissolve the enamel on the teeth, and I've seen patients who used to suck on lemons, and the teeth were so thin and fragile that they were chipping away.
What was that controversial ingredient that was in the toothpaste that many toothpaste companies had to remove?
I'm not sure what it was. There was something in total toothpaste.
Yeah.
And I don't remember
It was
the name of it.
stannous fluoride?
No, stannous fluoride is in the new toothpastes now. Is somewhat controversial, but the one that was removed was in total toothpaste, and I think it was a hexachlorophene-based chemical. I don't remember what it was, but it destroyed all the normal bacteria in the mouth, and many of them that are necessary for health.
Great. And then last one for you. Can a water pick replace flossing?
I don't think a water pick can replace flossing. I think a water pick's important. I think it's helpful. But I think cleaning between the teeth with either small brushes or floss or both is not replaceable with a water pick.
Great. Thanks so much, Dr. Nemeth. I appreciate you.
Take care.
Yes. All right. So we are going to be doing this again in the very near future. Andre, you can get in touch with Dr. Nemeth on our website, or you can email at info at drnemeth.com, drnemeth.com. If you would like to send us any information, any videos, any photos, you can email those to info at drnemeth.com and we'll get back to you. We could schedule an appointment. We have people that travel from all over all the time to see him. So thank you everybody for writing in. Dr. Nemeth and I and everyone here had a fantastic time. We're going to be doing this again in September. And we're going to be upgrading it every time. We're trying to get to everybody's questions just so that you guys can be as healthy as possible. So thank you so much for tuning in.